Mental health issues, substance abuse, and suicide are on the rise among the U.S. youth, a toll of the pandemic lockdown. Dylan Buckner, a promising student athlete from Illinois, died by suicide in January.
I believe that if COVID hadn't happened, or if the country's response to COVID was better, that Dylan would still be here today.
Since this pandemic, we've lost 20 students to suicide.
The nation's fifth largest school district, County School District, which includes Las Vegas, Nevada, restarted in-person classes after a surge in student suicides.
Between April and October of 2020, hospital emergency departments registered an increase in visits by children between the ages of 5 and 17 years old for mental health-related issues, according to the Centers for Disease Control.
Well, there's an avalanche of depression and anxiety. I have 5 cases right now that are suicidal. They're primarily cutters, and they are isolated types that didn't fit in before, but now that they're totally physically isolated, they feel nobody cares, nobody loves them, nobody wants to touch base with them from school.
Matthew Hernandez is 17 years old. He has struggled with remote learning and has feelings of isolation.
It's just sort of, I lost like the motivation to sort of, keep going. So, of course, my grades all dropped. I mean, I wasn't really going to class. I wasn't really doing anything when I went.
What did you miss the most about school?
Definitely just being able to hang out and talk with friends. That's what made school, worth going to and worth learning, I guess, to have friends along the way doing it.
The absence of structured in-person learning has disrupted other aspects of children's daily routines, including their eating habits.
I would eat more because I had more time during the day, but then I would eat less because I would be on my phone during that time, so I just sort of forget to eat. So yeah, I just went back and forth. Some days I would be bored, so I would eat something, and then other days I'll be bored, so I'll be on my phone and I wouldn't eat.
During lockdown, many kids were less physically active, and those in poor neighborhoods had limited access to affordable and healthy food, leading to an increase in child obesity. COVID-19 isolation also contributed to an unhealthy increase in screen time.
So what were you doing to fill up all that time?
Just on my phone, just scrolling down TikTok, YouTube, whatever I could use to, occupy the time, distract me, I suppose.
Children's mental health specialists believe that some sort of normalcy can only be achieved by fully reopening the American education system.
I need for schools to reopen yesterday. I need for them to reopen completely. I see them, when they do have COVID, they bounce back, they take that child and maybe the students in that classroom out, and everything else continues to function. But we're missing on too many psychosocial elements by not being in school. It's not just the academics. I'm worried about both. I'm worried about their self-esteem.
Nitza, Soledad, Perez, CGTN, Miami.